Great. So welcome everyone and happy Social Service Workforce Week. Thank you for joining us today as we celebrate and recognize the crucial role of the social service workforce in enabling safe and stable family care for children. My name's Alina Sherman and I'm the Communications and Advocacy Manager for the Global Social Service Workforce Alliance. Before we get started, I'm going to briefly go over some logistics. This event does have simultaneous interpretation in Spanish available. Please be sure to, at the bottom of your screen, click on the interpretation button and then select either English or Spanish. So again, you will need to look at the bottom of your screen, look for that interpretation button and select English or Spanish. So to briefly just introduce both organizations hosting this webinar, the webinar is being co-hosted by the Global Social Service Workforce Alliance and Better Care Network. If you're not familiar with the Global Social Service Workforce Alliance, we are a network-based organization which seeks to build a world in which a well-planned, developed, and supported social service workforce is better able to address the needs of at-risk individuals and communities. Through our network of over 3,800 members across 150 countries, we build and channel the political will, actions, resources, and structures necessary for a workforce that is capable, knowledgeable, reflective, resilient, and committed. Membership is free, so if you are not a member, we do invite you to become a member on our website to make sure you stay informed of new resources being developed all across the world from a variety of organizations, as well as opportunities to engage with us. To do so, just go to our website, www.socialserviceworkforce.org. The Better Care Network is an interagency network that facilitates global information exchange and collaboration among a growing number of organizations, governments, community groups, and individuals working to strengthen children's care across the world. The BCN website is the world's leading library of resources to facilitate global action for children without family care. BCN also acts as a convener for a range of interagency initiatives to establish more strategic sector-wide collaboration spanning the global to the local level and inclusive of a wide range of stakeholders. This includes convening the Transforming Children's Care Global Collaborative, which brings together over 900 organizations and individuals from 100 countries working to reform care and protection systems for children. The thematic brief, which you will hear about today, was developed under the Transforming Children's Care Global Collaborative. So just a brief overview of our agenda. We do have quite a packed agenda. This webinar is an hour and a half. We are lucky enough to kick it off with opening remarks from Jamie Gao, the Children and Adversity Team Lead with USAID. We'll then turn it over to Beth Bradford from Maestro International, who will give an overview of the 2024 State of the Social Service Workforce Report and thematic brief. And then we will have a great panel focused on, at a global level, efforts to strengthen the workforce for family care. Hugh Salmon, our director, will moderate that panel. Then we have 5 panelists. We have Anastasia Orchietny from Moldova State University, as well as from the Ministry of Labor and Social Protection. We have Mr. Pitikanta Panda from Odisha State Child Protection Society in India. We have Maria Jose Ortiz from the Secretariat of Social Welfare Guatemala, Mariam El Qassam from UNICEF Jordan, and then we also have Sumaya Nasuna from Child's Eye Foundation and the Association of Care Leavers of Uganda. So again, quite a packed full agenda. Just a few very brief logistics. Feel free to introduce yourself at any time via the chat button, where you're from, your organization, your name, And then also be sure to submit questions at any time via the Q&A button for speakers and our panelists that they will answer at the end of the panel. This webinar is recorded and will be made available on the Alliance NBCN websites in both Spanish and English. I will now turn it over to Jamie Gao, the Children and Diversity Team Lead at USAID, who we're lucky enough to have provide opening remarks for us. Jamie?
Thank you, Alina, and good morning, good afternoon, and good evening to everyone who is joining from around the world. I'm thrilled to be here today to celebrate the Social Service Workforce Week with all of you and to recognize the progress that has been made to strengthen the social service workforce for family care and care system reform. I'd like to start by thanking all of the social service workers who are out there. Thank you for the critical role that you play in supporting individuals in need, in strengthening vulnerable families, and in ensuring protection and care for children. As Alina said, I'm Jamie Gao. I'm the USAID Children in Adversity Team Lead based with USAID Washington. And our team coordinates implementation of the Advancing Protection and Care for Children in Adversity U.S. government strategy for children to thrive, or the Thrive strategy in short. We're thrilled to have launched our updated Thrive strategy this summer. And what it does is it outlines the US government's interagency commitment to investing in the development, care, dignity, and safety of the world's most vulnerable children and their families worldwide. The Thrive strategy recognizes that the social service workforce is fundamentally important to enhance the delivery of early childhood development services, to support family care, and to prevent and respond to violence against children. The social service workforce is often the first line of response for children, families, individuals, and communities who are facing adversity. And the Thrive strategy articulates the US government's commitment to support children who are separated or at risk of separation from their families by promoting, funding, and supporting nurturing, loving, protective, and permanent family care. Aligned with this commitment, USAID does assist countries to reform their child protection and care systems by strengthening policies and practices to prevent family separation, support safe and stable family reintegration, and family-based care. As we all know, a robust social service workforce with the right number and variety of social service workers, along with the required competencies, skills, and support, is central to effectively promoting family care for all children and protecting children who face adversity along with their families. So this is why I'm thrilled to be with you today to celebrate the vital role of the social service workforce to support family care and care system reform, and to discuss during this webinar the importance of creating a well-planned, developed, and supported workforce capable of implementing these reforms. So with no further ado, I'm very happy to hand things over to Beth Bradford, a Senior Technical Advisor at Maestral International, who will give an overview of the Alliance's 2024 State of the Social Service Workforce Report, which focuses on the social service workforce and family care for children, along with the new thematic brief on the same topic, which was produced by the Global Task Force on the Social Service Workforce in Care Reform, and that is part of the Transforming Children's Care Collaborative. So over to you, Beth, and thank you.
Thank you, Jamie. Good afternoon, good morning, good evening, everyone. I'm very pleased to have been invited to present to you a little bit today on these two important documents. I'm Beth Bradford from Maestral International, and a just warm welcome to all of our participants. Just a quick reminder to use the Q&A for questions that you might have as we're presenting today. As you likely all know, the lack of family care remains a critical issue worldwide, with an estimated 5 to 6 million children separated from their families and living in residential care facilities. Millions more children are separated from their families, living in other forms of alternative care, such as foster care, or without any form of formal care, either on their own, perhaps with siblings or peers. Most of these children have at least one living parent or relative willing to care for them if provided with the right kind of support. Many more children are at risk of losing family care for a range of reasons. The international consensus and growing pressure for reform increased awareness about the detrimental effects of institutional care, combined with the evidence now available on how care systems can be reformed and safely transition away from institutional to family-focused care, has led many countries to enact laws and develop strategies to achieve this transition in line with the UNCRC and other international frameworks. Many countries have made significant progress over the last decades. The case for this reform has been further underlined by increasing the evidence of the cost of inaction if governments fail to invest in strengthening families to care for children. One area of the reforms is putting in place a suitably trained, supervised, motivated, and resourced social service workforce, working in the community and with the capacity to provide or arrange, monitor, and support the types of high quality support, care, and protection that children and families need, and when they most need it. Donors, international NGOs, regional bodies, and many others are contributing to change by focusing their investments on child well-being, social protection and education, child protection, and care system reform. Civil society organizations and care experienced youth are all playing crucial roles in promoting and implementing family-based care models, developing standards, providing training, building government, and community capacity within the goals of care reform. A strong and effective social service workforce plays an essential role in protecting children and strengthening families so they can care for their children safely, preventing family separation whenever possible. They also play a key role in providing the range of suitable alternative care options and in working with children and families to support reintegration whenever that's possible. In doing so, they ensure that children and families are involved in the decisions on their care, and the plans that are made for children's care and protection are always in their best interest. At a national level, social service workforce workers play a critical role in helping reform child welfare systems and helping states fulfill their obligations to support families to care for their children and transition away from large-scale institutional forms of care. The 2019 United Nations General Assembly resolution on the promotion and protection of the rights of children was signed by all member countries. It urges investments in social services and the workforce who provides them. It specifically highlights the need for improvements in planning and decision-making on alternative care, which of course relies on a suitably qualified and trained, as well as a resourced workforce being in place capable of making these decisions. Following on the UNG resolution, global actors formed a global task force under the Transforming Children's Care Global Collaborative Platform to further unpack the resolution and provide practical implementation guidance to governments in addressing the various recommendations, including around the workforce. This led to the thematic brief, which I'm going to talk about in just a moment, on the social service workforce and care, developed by a group of more than 40 organizations coming from all across the world. In addition, the care sector has been working to document reforms, including their implications on the workforce. In 2016, the Global Social Service Workforce Alliance and the Better Care Network compiled a report on the role of the social service workforce in care reform. At that time, there were a handful of countries with experiences to feature. But in part, the working group of the thematic brief highlighted the amount and range of experiences and depth of practical examples that have now grown, covering all regions of the world. Thus, after the more targeted thematic brief, it was decided that we would also focus the 2024 State of the Social Service Workforce Report on a deeper dive into the role of the social service workforce in children's care. Next slide, please, Alina. Strengthening the social service workforce is essential to help countries meet their national commitments to care reform. The thematic brief was developed by a global task force, as I mentioned, to help government and policy decision makers understand the essential role of the social service workforce in achieving care reform, including family-based care, and how to strengthen that workforce in terms of its structure and competencies. You'll find a link to the thematic brief in the chat. It's now available. The main policy and practice issues and key recommendations with accompanying country examples are featured in this thematic brief. It's part of a full set of thematic briefs under the Transforming Children's Care Global Collaborative platform, a community of many hundreds actually now of organizations and actors working to make sure that the UN General Assembly's resolution is put into action by countries. The thematic brief includes high-level guidance, recommendation, and practical examples from a diverse set of contexts, really to consider developing, supporting, and strengthening the social service workforce. Looks like we don't have the presentation slides, but I'm sure those will come back. I'm going to just continue for the sake of time. Some of the details are around the key ways that the attitudes, practices, and behaviors and approaches are taken by the workforce, where those need to change to be aligned to the goals of care reform and comply with international norms. Let's take a look at the next slide and some of the specific content of the thematic brief. The brief covers who the workforce in terms of children's care is, what the international commitments and obligations are, the recommendations around developing a strong legal and policy framework, a social service workforce with adequate competency and capacity, how to set up how to set up monitoring and accountability around the workforce, recommendations around resourcing and long-term investment. And then it dives deeper into strengthening practice. And here the thematic brief talks about strengthening practice around family strengthening, around case management, around the coordination and support of referrals, around gatekeeping and best interest determination, family reintegration, and support and monitoring of alternative care placement. Finally, the thematic brief does share additional resources, again, aimed to help government actors really put into action the UN General Assembly resolution. Next slide. As a result of the task force work on a thematic brief, it was also decided that we would like to take a deeper dive and use this year's 2024 State of the Social Service Workforce report to dive deeper into the topic. This report will be available soon, we hope by the end of this week, and all of you who registered for this webinar will receive a notice. This year's report really zeroes in on the critical role that the workforce plays in ensuring children can always benefit from safe and stable family care, whether that's in their own family or through family-based alternative care when needed. The level of interest in the topic and the country experiences, illustrative examples came through the development of the brief, but were an impetus for making this topic also a focus of the annual report. This is especially important because this year, 2024, marks the anniversary of the UNGA resolution. We really hope the report will inspire continued efforts by governments and their partners to strengthen the workforce so that all children can thrive in safe and loving family environments. Additionally, through profiles of social service workers, we aim to bring to life the various roles and backgrounds of these professionals and the vital role that each can play in care reform and ensuring family care for all children. The report was informed by close to 30 interviews, and later on, we're going to hear from some of those actors. The report aims to highlight the crucial role of the social service workforce in strengthening families, in preventing separation, in the provision of alternative care, in placement decision-making, and in reforming care systems. How the workforce strengthening is being taken into account within alternative care policy and legislation and care reform strategies, and then also more directly in transitioning away from residential care models, developing new community services, and child care protection data and evidence. The conclusions provide implications for planning, developing, and supporting the social service workforce. The next slide. Similar to the thematic brief, the content of the 2024 report dives deeply into the types of social service workforce workers working in family care, their roles and functions within that care system, as well as the roles that they can play in reform and in system strengthening. It talks about some of the common challenges across these diverse geographies. And then, as I mentioned, provides recommendations around further planning, developing, and supporting the workforce. Let's go to the next slide and just take a quick look at some of the common challenges that were identified across these two reports. I'm guessing that they may not come as a surprise to any of you. The first one was really around the insufficient numbers of social service workforce, leading to excessively high caseloads, high demands, and unrealistic expectations of the community-based paraprofessional workforce, whatever that might be called in different contexts. The lack of curricula and technical content on child protection and children's care, particularly in university social work programs. The lack of time for, experience in, and commitment to engaging those with lived experience in meaningful participation. And we know that's a critical aspect of the care system and certainly of care reform. The need for policies, legislation, and standards developed that includes guidance or tools for implementing those policies in practice. It was also mentioned many times by different actors, the poor working conditions, inadequate salaries and benefits, and the lack of resources that the social service workforce faces when working with children and families. And when we talk with some of our colleagues a little bit later in this webinar, we're going to hear some examples where countries are addressing these kinds of challenges. There's also a number of misconceptions, both in the community, but also within the government systems on what the role of the social service workforce is related to children's care. So coming out of these challenges, we could go to the next slide. There are some cross-context recommendations which are featured in the State of the Social Service Workforce Report. We hope that you'll be able to look at these and contextualize them and make them relevant for the context that you're working in. The first set of recommendations is around planning, how to really develop laws, policies, and standards that are supportive of a strong workforce. Really fleshing out and making clear the definition of different workers, of their roles, and also certainly of the ratios of clients to social service workers. How to make sustained investments and include the social service workforce in the national budget. And then there are recommendations around practice guidance. Next, we have a set of recommendations around developing the workforce. These come around competency-based training and education, addressing social norms that affect children and families, but also that influence the social service workforce practice. Really bringing in lived experience, which I mentioned earlier, is another set of recommendations that we've included. And then finally, on supporting the social service workforce, developing a framework for regular and supportive supervision for social service workforce working in family care for children, supporting safe working conditions, well-being and self-care of the social service workforce, promoting and strengthening national professional associations, and promoting better awareness of and support for the social service workforce among the public. We really need those supportive attitudes in order to be able to do work within care systems well. So that's a lot of information on the context of these two very important reports. We hope that you'll find them useful. You'll share them widely. You'll use them in your work with government. We really feel they offer a lot. But to see what it really looks like in practice, let's go over now to Hugh Salmon from the Global Social Service Workforce Alliance and his guests who are going to share what all of this looks like from the country context around the world. Welcome, Hugh.
Thank you so much, Beth. That was a really comprehensive preview of the report, which you'll all be receiving soon, as well as both the State of the Social Service Workforce report on this topic and a more specific thematic brief, which is for policymakers. So it's great to hear those findings summarized so beautifully. So as mentioned at the beginning, I'm the director of the Global Social Service Workforce Alliance, and it's a huge thrill for me to see so many of you that I've worked with over the years and so many of you who are very active members of our alliance. So thank you so much for joining today. So we're going to be hearing from the panelists that were mentioned at the beginning, but for those who've joined late, we're going to be hearing from, I'll just do first names for now, Anastasia from Moldova, Pritikanta from India, Mariam from Jordan, and Sumaya from Uganda. And I'll say a little bit just to introduce them, but then we'll go straight into the questions. And so I'm going to sort of ask each panelist a couple of questions in turn, but we're also going to try and respond to the Q&A. So please keep your eyes out for the Q&A, because we'll try and address additional questions as they arise as well. So my first question is to Anastasia Ocheretny, who is from Moldova State University and also a consultant to the Ministry of Labor and Social Protection in Moldova. So Moldova is a country which is quite well known globally for its great progress in achieving care system reform, and was therefore featured in our 2015 report on this issue, on the role of the workforce in care reform. So Anastasia, if you could just summarize for us, what do you see as the main advancements since then in terms of social service workforce strengthening for children's care?
Hi, Hugh. Hi, everyone. It's an honor to participate in this webinar, and I would like to share some experience in since 2015. I would like to mention that this training of social workforce is one of the priority of the government of the Republic of Moldova, and is a key intervention of the national program in child protection that was approved in 2022 by the government. And this program contains a specific objective focused on the provision by professional training institution of the system of child protection with qualified human resources. Based on this objective, a common agenda of the Ministry of Labor and Social Protection, academia, civil society, and development partners was established. I would like to mention that in March 22, the ministry and the Change the Way We Care project that is implemented in the Republic of Moldova, the working group was launched. And I would like to mention that this working group contains representatives of the government, especially the Ministry of Labor and Social Protection, academia, civil society, representatives from territorial agencies of social assistance, and also the representative of civil society. The working group members were encouraged to share information, and if in the first meetings participated 15%, during the time the number of the members increased, that is an indicator that the working group represents an interest for the all actors actively in the child protection system. I would like also to mention that one important acquisition for child protection system is that in November 22, a memorandum of understanding was signed between Ministry of Labor and Social Protection, Ministry of Education, and 4 universities from Moldova that are involved in training specialists in social work. And this memorandum of understanding cover more areas of intervention, for example, professional training, research, expertise area, and promotion of social work professions in the Republic of Moldova. This memorandum is implementing via action plans. Also, in order to understand the need of specialists in the Republic of Moldova in order to train and to develop training programs, several studies were conducted, and based on these results, were developed several methodologies for trainings, for trainings and for supervision, professional supervision. But due to the new reform in the system, the new reform of social system in Republic of Moldova, we call restart reform, this methodology need to be adjusted to the new regulatory framework. I would like to mention that this reform brings a new structure of social work system also and child protection system, because now the social work or social system in the Republic of Moldova is organized in 10 territorial agencies of social assistance and 3 territorial independent from the ministry territorial structure of social assistance in Chisinau 2 and in Gagauzia in south part of the Republic of Moldova is another territorial structure. But all the system is working on the regulatory framework developed by the Ministry of Labor and Social Protection. And what we realized in this period of time is that the ministry amended and the government accepted the amendment of legislative framework, and now the Ministry of Labor and Social Protection will be responsible for organizing the training system, continuous training system of social workers and all the specialists that are involved in social services. And in this context, a new subdivision was created in the Ministry of Labor and Social Protection. But this subdivision will be responsible not only for organizing a training system, but also organizing the system of assessment in order to obtain a qualification degree for the specialists that are involved in social services. Now the ministry is in the process to finalize the secondary legislative framework, and we hope that starting with next year, the system will be implemented fully. Also, a new acquisition in the field of child protection is that the number of the child protection specialists was increased. At the moment, with the support of UNICEF, are hired 150 specialists, but the target is to have 300 specialists in following years. Also, a new position we have in this.
Thank you so much, Anastasia.
Yeah.
Sorry, we're running out of time. Could you just okay. say in 3 words the new position, then we'll have to move on. Sorry, because you've excited us. Just finish your sentence about this new position.
Yeah, I would like to mention several moments. It's because Moldova has important step. We have new position for specialists in protection of violence victims at the territorial agency. Also, we are under piloting a new concept, how to implement family primary support, and was conduct a study. Also, we have new qualification standards in social work for bachelor, master, and PhD level, and with the support of civil society, development partner is in process to be finalized the new standards, qualification standards for specialists in child protection. We have a lot of activities conducted in this period of time, but all the activities are focused to strengthen the capacity of all the professionals in social work, but especially in child protection.
Wow, that's really amazing, and it's as you know, I was there about 24 years ago now, and it's incredible to see the progress since then, and particularly I think that the level of innovation at the local level, which then gets replicated nationally, and the fact which is so important for achieving family care, the combination of prevention support for families, but also support to enable reintegration. And also alternative care, which is family-based wherever possible, kinship care and foster care. So those three pillars have been, I think, part of the reform from the very beginning. But now we've heard a lot more about the kind of workforce that's needed to implement those pillars, particularly in terms of being available, accessible, and high quality for families at the moment that they need them most. So that's very impressive to hear. Thank you so much from Anastasia. So I think we'll move on now to Guatemala, if that's okay. Maria Jose. So I just want to be absolutely sure that Maria Jose has also selected the Spanish. Well, you'll be speaking in Spanish, but people who need to select your language, make sure that you've selected the correct language at the bottom. Si alguien está esperando o escuchando en inglés y quieres español, tiene que seleccionar la opción abajo, donde está el símbolo de interpretación. El símbolo del mundo. Okay, so I think that probably enough in case anybody was in English that wanted to be in Spanish. So now over to you, Maria Jose Ortiz, she is the Child Protection Subsecretary and Deputy Secretary of Special Protection in the Secretariat of Social Welfare in Guatemala. So a warm welcome to Maria Jose, and we just would like to hear from you a couple of questions, but the first question is really, we understand that Guatemala uses a very interesting model for strengthening the government workforce responsible for children's reintegration. So could you speak a little bit about the model that you use, and then a little bit more about the collaboration that you have with universities? But initially, if you could say a little bit about the model that you have for strengthening children's reintegration from children's homes, that would be very helpful. Thank you so much.
Thank you. It's nice for me to participate in this webinar. I will continue my presentation in Spanish because I am not a fluent speaker.
Okay. Thank you. And everybody, if you've not yet selected, please select if you need English translation from Spanish, then just select the globe at the bottom and then choose the English channel.
Bueno, en el sistema de protección guatemalteco tenemos la particularidad que el sistema es totalmente judicial. Esto quiere decir que cada vez que hay un problema con una situación que afecte a la niñez o adolescencia, esto hace que el caso sea conocido por el sistema judicial. Acá quiero referirme a...
Sorry, could you wait a minute? I think we're not hearing the English interpreter. I don't know if the English interpreter could just make sure all your settings are working. Okay, try again, Maria Jose, please.
¿Está bien la interpretación en este momento? Para poder continuar con la presentación.
Well, thank you. And I was explaining that in Guatemala, the system is totally judicial. And what it means? Well, it means that every time we are aware potential vulneration of a child and adolescent, it is presented to a judge. And we try to reestablish the rights of that child. And how do we proceed with it? Well, we have a government entity that is in charge of rescuing the child. And what it means is that once you are aware about a potential case, they have to visit the place where the child is, and they have to take the child to take it to the judge. They have to separate him, her from the family, and to know the real situation of the child. Unfortunately, in Guatemala, we use the institutionalization in protection homes, and it is a common measure. And it is because of the lack of social resources that we have for this kind of cases, or for the thought that the judges have. They prefer to take the child to this residential care home instead of risking the child's welfare. And it's like they are afraid of the condition of the child, and they took them to these institutions. And here is where we have this government institution that is the welfare secretariat, and they take care of those residential care institutions in Guatemala. And in this government institution, we are working in a holistic way the child. We try to create psychological, medical, social services interventions, and different aspects that may be needed, like education, physiotherapy, and among others. And on the other side, we are also working with the biological family of the child. And we carry this out with social work teams. And these social workers visit the family. They try to work with them, and they try to see what was the origin of the separation. And they follow a methodology that is analyzing the strengths of the family, to try to help them, to try to support them, and try to cover the weaknesses the families may have. And they try to educate them with positive parenting in order to reestablish even the discipline they may handle into an assertive discipline. And they invite them to be part of different programs, to be part of different attention services for alcoholism, for other situations, empowerment for the mother in case she's suffering domestic violence, and other kinds of interventions. At the same time of this work with a family, and in the institutions, we have been working with the child. And the work that we have done is the child to cope the effects of the vulneration the child is suffering. And then we try to proceed with the reunification of the child with her family. And at this moment, we are also looking at judicial authorization. We request that approval through a hearing. And it is a legal hearing that we have to wait. And in that hearing, we present the family duly empowered, and we present the family as a suitable resource for the child. That is the moment when the judge decides to reunify the families. And the process does not end here. We have to continue working, supporting the family, supporting the child, in order to make sure that the child is safe. And this work is carried out by the social workers of this government institution, SBS, that is working with a model we have as pair work. And this is a psychology, and it is a social worker, and they together work in the family to see some aspects of the family environment where the child is living, as well as some specific problems that may occur in the attitudes of the families and the children. Once we have worked for some time with these families and we can observe a good integration of the child in the family, in that situation, we can close the case. That means that we close it when we have had a successful reintegration of the child. Here, the work of the universities has been excellent for Guatemala because we have an agreement of collaboration with the state university, and some social workers of this state university can support the different services that we provide in the SBS. We also have some other agreements with other faculties of this university in order to try to serve these residential care institutions.
Thank you so much. And sorry for rushing you a bit towards the end there, but that was amazing to hear. And it's interesting that there's already a common theme emerging. We're hearing about the importance of multi-agency, multi-stakeholder cooperation and collaboration. And I think this feature of working with the universities to strengthen the training and education of the workforce and the standards for that is something that we've heard from both Moldova and Guatemala now. But particularly interesting in Guatemala, I recall from my own work in your region, the importance of the word accompaniment and how you very much work alongside the family. It's not so much doing things to the family, but you're accompanying, you're working alongside, but in the same time, you're combining psychologists and social workers working hand in hand, which is very, very important. And it's also the twin track approach of intensive multidisciplinary support to the child, whilst at the same time working with the family and preparing the child and family for reintegration. So it's a wonderful concept and very integrated. So wonderful to hear. Thank you so much, Maria Jose, and great to have you with us. Okay, now we'll move across to India, if that's okay. And we'll move across to Mr. Pritikanta Panda, who's the State Program Manager of the Odisha State Child Protection Society, which is a state body in India. And if Mr. Pritikanta, if you're able to open your video now, and I'll just ask you a few brief, okay, I can hear you now. Perfect, thank you. So yeah, it would just be great to hear from you already. The first major question is if you could just obviously speak up, as we said before, and if you could tell us a bit about some of the training and ongoing mentoring that you provide to the social service workforce at the different levels. So at the state level, which we know in India, it means, you know, millions of people, very large geographical area of the state, also then the district and down to the community level, otherwise known as the panchayat level in India. So if you could tell us about how the workforce is trained and mentor at the different levels, given the recent increased budget allocation that you've been giving to child protection and care support. So it'd be lovely to hear from you about those things. Thank you so much.
Hi, greetings to all of you. Thank you for including me in this panel discussion. Before I respond to your particular question, let me introduce myself. I belong to a state of the Indian Union, that is Odisha. We have around 48 million people in the state. So in the state level, we have Odisha State Child Protection Society. The society is the nodal agency for implementation of the child protection activities all over the state. So at the state level, everywhere for the child protection functionaries, we used to prepare a calendar of training program, the annual calendar program, and it is supported with a training module for the all particular training programs. Similarly, at the district level, the district child protection units of the society is constituted, and district child protection units are assigned to prepare their module and their training calendar for the financial year. So it is a regular part of the system that there should be training calendar and training program. Of course, we need budget for that. And we have two type of budget. The state is having 13.19% budget for children, and Odisha state is having children budgeting provision. It is like collaborating the provision by different departments for children, and it is presenting and analyzing that how much progress happening. Besides, at the state level, normally we do some TOTs, training of the trainers. So we do it in collaboration with a State Institute for Women and Children, State Institute for Rural Development, State Police Academy, State Academy of Administration, the Legal Law University, and then in collaboration with the INGOs and the local NGOs, and of course the State Judicial Academy. So at the state level, we do some hand-holding training, some training of the trainers, and at the district level we do training of the practitioners, particularly like the media, the police, the child helpline workers, child protection workers, and that at block level it is below the district level, and it is the cluster of the gram panchayats. So at the block level, we train the frontline workers, which includes Anganwadi workers. They run the daycare centers for the children for early childhood care education and their engagement activities. We have around 73,653 Anganwadi centers, which is taking care of the early childhood care education and their activities. Besides, we do training the ASA workers, those who are situated at every village. They are accredited social health activists. They are also available at the village level. And we do train the Panchayat Raj institution, the elected, local elected body members, those who are the particular influence at the community level. So for this training, directly for the child protection activities in the training in the state, it is around 1,40,00,000 rupees budget provision is made for the annual budget provision, which includes 4 lakh rupees at this district level. So this is not only limited to this program. Besides these, different departments like Panchayat Raj department, they used to have a regular academic training program. They do training of the panchayat level workers, elected bodies regularly. We form the child protection and welfare committees at the gram panchayat level, block level, district level, and the state level. These committees are also being trained by our child protection functionaries, those who are trained as master trainers at the state level. So the training includes two types of interventions. One is preventive preparation, how we can prevent the child at the community level so that the child don't get detached in case of in family disorganization. And another is if certain situation is arising, the child is pressurized and the community is not able to continue the child in their local situation, then the responsive things. So in two ways we train our people. One is preventive approach, and in Odisha context, the kinship care is an ethnic practice. So people normally love to take care of the children, those who lost their parent and their relatives, particularly in both areas, the paternal and maternal. So they used to take care of, unless they have some financial scarcity. So the sponsorship program by the state, it is addressing the financial scarcity for them. Of course, in collaboration with some NGOs, which includes changing the way we care and some other people. We have initiated some foster care program also, but mostly the kinship care, the sponsorship program and non-funded kinship care, it is very much popular in the state. Means in every district, we have 30 districts in the state. Every district, we have child welfare committees, those who are the bench of magistrate committees, to take decision on the case of children in need of care and protection. So if a child in need of care and protection is coming to the purview of the child welfare committee, normally they ask the parent or the caregiver to continue the child in the community, and they order the child protection functionaries to make an inquiry. And if there is very much emergency, like the child is run away from the family, or the child is got abused by the family itself, so if there is a threat from the community or the family, we continue them to get institutionalized. Unless, in the other cases, we ask the community people or ask the temporary caregivers to continue the child in the family till the inquiry process is completed. Once the inquiry process is completed, if there is a requirement of financial support, we use these machineries. Besides the child protection, sponsorship and foster care, let me complete in 30 seconds.
Yes, yes, sure.
Yeah, we have the state-sponsored different programs of collaboration and convergence. We focus on family strengthening so that they don't try to detach the child to institutionalization. We have a green passage program. It provides free education, unlimited free education to the orphan child in the government institutions. Means it is not limited to the 18 years of age. If the child has lost the parent during the childhood, means within on 18 years of age, then in the latter days, after getting the adulthood also, he can continue free education in the government institutions. It includes both technical and non-technical education program. We have food security program, which provides free food, we have midday meal program. So these are also supplementing our child protection activities. So this much from the training side. Thank you so much.
Thank you. Thank you so much. And again, sorry for rushing you at the end, but we've covered so much and we have a little bit more to go. But that was a wonderful summary, really, of firstly, how it's important to train the workforce at all the different levels. Secondly, to train them in both prevention and response, because obviously where a child is in need and can be supported in the family, that's the priority. But if the child is at risk, then of course there might need to be an intervention for the child to be put in a place of safety. But you did emphasize, which was also encouraging to hear in the context of today, that kinship care is prioritized, and where it's non-formal, it's traditional, but there is also financial support available through the various schemes, as well as free access to education and health. Those things are also very important for both children in family care and in kinship care if they need to move to another relative. But then, of course, foster care is also something that you're introducing thanks to cooperation with the international partners that you mentioned. So thank you. We're seeing so many different features of care reform and family-based care being strengthened through the workforce in Odisha in India. So that's wonderful to hear. Thank you so much. So moving across the globe once more, we're going to sweep back, having been from Moldova to Guatemala, and we're now swinging back across the world, and we're going to come to Jordan in the Middle East. So it'd be great now to hear from Mariam El Qasim, who is a child protection specialist with UNICEF in Jordan. And the question I'd like to ask you, Mariam, of course, you'll have a chance to introduce yourself, but is really if we could go a little bit, we're going to zoom out a bit more now to the macro level, so the national level. And in Jordan, if you could tell us about some of the considerations and challenges that Jordan has faced in transitioning to family-based care, so away from institutions to family-based care, given the specifics of Jordan, which surrounded by so many conflicts and refugee situations, and with many refugees coming into your country, given that your country includes both humanitarian and development settings, how have you been able to make that transition at the macro level? It'd be great to hear from you. Thank you.
Thanks, you, and thank you for inviting me here. I'm Miriam. I'm a child protection specialist at UNICEF Jordan Country Office. So to give a little bit of a background, in Jordan, we have several forms of family-based care. We have ihtidan, sort of like a kafala done through religious courts. We have kinship care, and we have foster care. Back in 2011, with the Syrian crisis and the reflux of refugees that Jordan has witnessed, we had a lot of unaccompanied and separated children coming in country, and it sort of organized itself to provide community care by refugees through kinship care, extended family, but also the need was there to introduce the foster family model to refugees. And since at that time the process was not formalized yet, we had to sort of unify the procedures around family care for refugee children, unaccompanied and separated children, and Jordanian children. And that was, at that time, standard operating procedures were introduced, and we had also statutory actors play a big role. We had the Ministry of Social Development and the Family Protection and Juvenile Police Department, who were all a part of the best interest panels. This is what we called them, and we followed the guidance of UNHCR also in this term. So this panel basically included all protection actors to decide on what's the best family-based care setting for the child. And the care setting itself was formalized. That meant that carers, refugees were able to take on critical decisions for their children. For example, approving medical interventions, enrollment in school and such. So that was a big step that those procedures were basically unified. We had like informal procedures, interagency for refugees, but then several years after 2011, that was formalized. So we had one path basically for all children in need of care, whether refugees or Jordanian children. Yeah, so and this is basically also following the country's course on deinstitutionalization and providing family-based care, trying to reduce the number of children who are institutionalized. This, of course, came with some challenges back in the days. I mean, even until now, there's still some hesitancy amongst refugees to formalize care settings, especially those under kinship care. That was overcome partially by having allocated social workers under NGOs, not statutory, because that's always a bit scary for the refugees and for citizens in general. So case managers or social workers would accompany refugee families to courts and provide the support that's required in providing the documents required, and even standing in front of the judges to get the care setting formalized. And all of the foster care setting was formalized. Kinship partially, we still have a lot, but I mean, that's also something amongst Jordanian families. We have a lot of extended family that informally does take care of their relative children. Another challenge was that the type of support required back then, also parenting programs, especially for unaccompanied and separated children, had to be introduced for the foster carers to be able to take care of their children. And we back in those times also, we did not have a concrete full-fledged program. Was more of like sessions with parents, and then providing that support through the NGOs and their caseworkers. And of course, financial support also was something that had to be carefully assessed and looked at to prevent any misuse. That's provided for refugee families to take care of additional number of children, let's say. And this on the other hand also remains a challenge due to austerity policies within the government. So the lack of financial resources also is sometimes putting the setting of a foster family at risk, because people would have second thoughts to consider taking in an additional child. And this goes for both refugee and Jordanian families.
Absolutely. And that's a common issue that was reflected also in India, wasn't it? This issue of making sure that if a family does take in a child, they are financially supported. It shouldn't put them at a disadvantage. And it was also very interesting that you mentioned formalization, because sometimes at a top-down approach, we think formalization is just inevitably a good thing. But from a bottom-up perspective, families can find formalization a bit scary when they've taken in a relative child or abandoned child that they know in their community. And then they're told, now you have to register, formalize, and you have to go to a court. So it was wonderful to hear, again, that word accompaniment, it comes in, that they were accompanied to go through the process. It wasn't done to them, but done with them in an empowering way. So that was wonderful to hear. I just have a very quick question, because we have a toolkit for mapping the social service workforce, as you're aware, and many countries have used it now. And I gather that you did a mapping of the social service workforce in Jordan. And I wondered how you looked in that mapping specifically at the care workforce to understand how much the workforce is already transitioning to be capacitated and in sufficient numbers for achieving family care. If there's anything briefly you could mention on that, that would be great.
Sure. So the mapping adopted the definition of the social workers being paid, unpaid, government and non-government, and community-based social workers and parasocial workers. And those meaning of the individuals who perform tasks, certain tasks, but are not officially professionalized or licensed, so to say. And the licensing thing is also something that's under progress currently in Jordan for all social workers. But when we looked at the mapping, we also ensured to, aside from a thorough desk review and conducting administrative data gathering, surveys, focus group discussions, key informant interviews with workers at the grassroots level. So everyone who worked for a CBO, the ones that are not, you can call basically parasocial workers, I think in our context. And then the ones affiliated with NGOs, and then the ones affiliated with the Ministry of Social Development, who are officially social workers. The mapping included or made sure to go through all of these different levels. And when it comes to care itself, so the direct service is provided through, let's say, if the case was identified by a non-government actor, case manager, or parasocial worker, all of the assessment and the services provided through that organization. But then, as I mentioned in the first question you've asked you on the best interest determination or best interest procedure panel, there needs to be a formal or statutory social worker that oversees the entire process and then who agrees to move the child from one setting to another. And for instance, in Jordan, this is only done moving a child from an institution out or in, or changing the formal foster care procedure has to be legally done. So that representative of the state is the official social worker that also conducts their own assessment, but then based also on a thorough assessment and pre-work done by case managers who work at the community level and directly work with individuals, again, refugees and Jordanian children.
So it's wonderful to hear actually that when you mention NGOs, your mapping covered the NGO workforce and the government workforce. And again, from a family perspective, that's so important because some families might be intimidated by the government, particularly if it's a refugee and they don't trust governments because they've had a bad experience. Yes. It seems that there's someone who can work alongside them that they feel they can trust and they can be approachable, but at the same time, formalization is necessary for those legal decisions. And so you have that connection to the statutory decision makers. So that's great to hear how that works in Jordan. Thank you so much, Mariam. And I think we just need to move swiftly on because we have one more panelist who I'd like to interview. And it's a real privilege to have Sumaya with us right now because Sumaya Nasuna is a social worker and she's from Child's Eye Foundation and the Association of Care Leavers in Uganda. And it's particularly important to hear from Sumaya because I personally am a social worker, but I've never had a social worker. And I've also never lived in foster care or a children's home. And I've realized over time that we really can't strengthen social services or care services without understanding the experience of people who've actually directly lived through those services or experienced them. So really that's the care experience that we need to feature prominently. And Sumaya is the person who's going to speak about that from the perspective that you have there right now in Uganda. So I wonder if you could just tell us a little bit, Sumaya, about how the perspective of care leavers and others with lived experience of care, of social services is so critical. And how have you in Uganda involved young people in this whole care reform process alongside the social service workforce? Yeah, over to you, Sumaya.
Thank you so much, Hugh. And I concur with what Beth said. It's very crucial for the participation of care leavers in the processes of care reform. And collaboratively with the social service workforce. Personally, I'm a social worker and also a young person with lived experience of care. So collaboratively, the social service workforce works with caregivers, especially the ones that are transitioning from care, through participating and engaging them in transitional plans and decisions, which also helps these young people to foster a sense of ownership and autonomy. But however, we realize most times at the time of exiting care, many still lack the opportunity to contribute to their transitional plans. And the social service workforce has been really crucial in providing mentorship and through life skills that are really essential for these young people who have been in care and have not been able to interact with the outside world, to enable them, giving them the skills that enable them to face challenges after leaving care. Secondly, young people with lived experience of care and children are provided with opportunities to voice their experiences and lead discussions on deinstitutionalization. I mean, for example, like this platform, which voices in turn shape policies and strategies for reforming care systems. And coming from a background of evidence-based, research has been conducted that focuses on key issues on care reform, featuring interviews of caregivers, and some of these documentations are being spearheaded by young people with lived experience of care. And these findings or this evidence really shapes many strategies and processes in reforming care systems per se. Some organizations advocating for care reform have incorporated positions for individuals with lived experience of care, promoting inclusion and meaningful engagement within their structures. However, we realize it is on a limited scope, and I think we attribute this to lack of knowledge and expertise for many caregivers who are unable to access education, to access higher education, to be able to get the skills and the profession, to get the professional skills, to be able to have access to available positions that demand formal expertise per se. And it's really crucial for having many organizations that are in care reform to have many young people with lived experience of care, but it is really on a low scale. Thank you so much, Hugh.
Thank you. And I just have one additional question for you, actually, Sumaya, which is really if you were to look forward, what recommendations do you have for further strengthening the workforce? So what more still remains to be done in Uganda to strengthen the workforce? And how do the recommendations coming from the people with care experience, how does that contribute to those recommendations? What are the young people telling us about what still needs to improve in Uganda?
Thank you so much. I think coming from a background of looking at the different challenges that are happening all over the care sector per se, we're seeing we have a limited number of professionals with personal experience of care, and we know this hinders their ability to effectively advocate for care reform because they are coming from a professional background, but they're not coming from a lived experience background. So that has been more of a challenge, and we call upon different CSOs and INGOs and every person to be able to give the skills and the tools to be able for the young people with lived experience to be able to have these particular skills to be able to advocate for themselves, and realizing also the social service workforce we have has limited skills or lacks capacity to respond to the unique needs of young people with lived experience of care. So I feel we need to address those capacity gaps with evidence-based learnings that are being informed by young people with lived experience of care to be able to articulately and adequately respond to their needs. And then also, as earlier said, many young people are not able to access education and be able to get the skills that they need. So if we empower the young people, giving them the platforms, the skills, the necessary accompaniments to be able to voice their issues, to be able to spearhead the conversations around care reform, that will be really crucial. And lastly, it will be more of having the policies and strategies in place that are informed by research and that has been undertaken by young people with lived experience of care. Thank you so much, Hugh.
Wow, thank you so much for a very comprehensive answer. And it seems to me like a real win-win solution when we have empowerment of young people with lived experience of care, because it's firstly empowering for them, so they have education, they have opportunities, they have a future. but it's also empowering for the system. When the system is strengthened with those insights, as you say, it's evidence-based. Frequently, we think of evidence as very long reports written by academics, very formal with long chapters and many statistics, but it also can be very much based on experiential information, which we're getting directly from people who've lived through that. And again, we need to balance that source of information. And I think you're really giving us examples of how that's been achieved and will continue to be achieved in Uganda. So thank you so much. And I think it's just to briefly give a little bit of a plug, if I'm allowed, something that we're actually doing as an organization right now in Uganda with Child's Eye Foundation, but also in India with Miracle Foundation, and in Brazil with another organization called Terra dos Homens in Brazil. We're doing precisely the kind of things that Samaya has been talking about. We're trying to bring together young people through those partners, and with Child Frontiers, we're bringing together young people so they and others with lived experience and their family members can actually come up with key testimonies, experiences, messages, and videos that can then contribute to further training of the workforce, and also advocacy to policymakers, so that the policymakers and decision makers can hear what they need to change and improve to make care and services really useful and responsive to the needs, the individual unique needs of different people, young people, children and families. So we're doing that right now, inspired by people like you, Sumaya. So that's great to hear. Thank you so much. And that's with the grant from Martin James Foundation that we're doing that particular project. And I'm sure you'll be hearing more about the results of that project very soon. So we now come to the sort of overall. So don't go away, panelists, because we now come to the overall questions and answers. So I've been having a quick look, and I see that there were actually two questions. I think they're pretty much the same question for Maria Jose Ortiz in Guatemala. It's great to hear that psychologists can collaborate with social workers in Guatemala. In the Philippines, there's a scarcity of psychologists available to work with social workers on family services. So do you have any recommendations for addressing that? So if Maria Jose, if you're still with us, do you have a recommendation for what to do when there are just not enough psychologists? How would you bring together the different skills of psychologists and social workers if there are not enough psychologists? I don't know if there's any thoughts on that from Maria Jose. Yeah, please, over to you.
Thank you for your question. I believe that it is very important to include in the different university academia syllabus options related to rights of children and adolescents. Right now in Guatemala, it is not part of the syllabus in the universities, and this limits the skills learned at school, but it can be learned in practice, but we cannot experience with the work that we do with children. So this is a weakness that we have to solve. And it's also important to strengthen the capacities like this and other spaces where we can give that training to the staff that works directly with the children and adolescents. I believe that the analysis of the strengths of the families has to be made, and to work with what are the elements for identification and determination of the interest of the child, so that the decision can be made to respond
Thank you so much,
to the
Maria
needs of the
Jose.
children
So we
and
actually
adolescents.
have one more question, which I'm going to take from the Q&A, and then just one more question that I'm going to take from the chat. So from the we've had a request to see the mapping in Jordan, but I think that there's already been a response to that it's not yet available, but hopefully it will soon be approved by the government. But before I come, there's a more specific question from Chipo about mapping. But before that, I'd like to see if any of the panelists would like to answer this question of it's difficult to get students to study social work. We have very low intake in our university. How do we increase interest in studying social work? So I don't know if any of the panelists would like to sort of raise a hand or just put your video on answer the question, how to inspire people into social work. Yeah, Anastasia, over to you. How do you inspire people to study social work in Moldova?
Yeah, it's a challenge for us also, for Republic of Moldova. The interest for social work was when we established this new study program, but now a great interest is for master degree, for master programs at all the university. And one solution for social work is to have distance learning programs, because almost all our students are working, and they prefer to have a distance study program. And maybe this is a solution for also for other countries. But now we are discussing with our partners, with the ministry, to have a campaign to promote social work as study program and the profession. A challenge is also the level of salary. When we will increase the level of salary, then social worker will be an attractive field.
Sure, absolutely. Thank you so much. And that's actually something that we do hear from other countries too. We do have some cases where people choose social work because it's an easier subject to get a place at university, but without actually actively making that choice. And so we do hope that they will meet social workers when they're at university and be inspired that this is really not just a subject, it's a profession that they can follow, and they will have good career prospects as well as decent salaries. It's very important to make that point. And also, I think I found I was the youngest on my course, and I graduated from my master's in social work age 25. Most people were in their 30s on my course at that point. So they had life experience, not necessarily care experience, but they had so much life experience of bringing up children, of having marriages and divorces and having all sorts of things going on, and personal adversity. And those kind of adversities help them as students of social work. And some people come to social work with a personal experience, some with a professional aspiration. So there's many different routes into social work, and it's when they combine. And so distance learning and online learning enables people who are already busy in their careers, supporting their families, to make a transition into a new career. So it's interesting that you have that undergraduate traditional route, but other routes into social work. So that's a wonderful answer. Thank you so much. I'd like to now switch, if it's possible, to our colleague from India again, Pritikanta. If you could answer one question that we're having in the chat from John Williamson, which is around how would we switch from residential care to family-based care? Because you did mention supporting families through preventive support, and you mentioned kinship care and foster care, but you did mention that if a child is at risk right now and there's a need for emergency intervention, they still need to go to some kind of shelter or residential institutions. Other countries have emergency foster care, so that there is even a possibility that at 3 a.m, a prepared and approved family, not a relative, but a prepared and approved family who is, as it were, like in Moldova, they call them more like professional foster carers. They could take that child, and the child never has to go inside an institution. Do you have anything like that? Or is there, if that's not possible, are there other steps that are being taken to move away from the use of institutions to a more family-based approach to alternative care?
We have a particular gatekeeping provision for institutional care. As a result, we have closed 30% of the childcare institution during the last 10 years. Around 100 childcare institutions has been closed, and 500% increase in non-institutional care numbers. That includes sponsorship post-care. So the thing is, our first target was after starting the child protection program in full time in 2012 and 13. So in that the first target was to deinstitutionalize and reunite children, those who have both parents in the community, but due to incapacitation or any difficulties, they got admitted in institution. So we got reunited them. Then after that, our target was to reunite the children, those who are having at least one parent, single parent in the community, with financial support. So that time our target was 75% of the sponsorship support was meant for rehabilitative sponsorship. That means someone already admitted in childcare institution, and that the child will be rehabilitated with the single parent available at the community. Okay. Then 20% was meant for preventive. Time by time, the rehabilitative cases has been addressed. So now the particular children, those who don't have both parent, they are prioritized to get admitted in childcare institutions, and they lead to adoption for making the process. And those who are not adoptable and are in temporary care, we try to reunite them. And in preventive measures of the gatekeeping procedure, we are giving that. And side to that, Indian government has made a very historic decision. Recently, for institutional care, Indian government is paying 3,000 rupees per child to the institutions in a month. But for the non-institutional care, the government of India is paying 4,000 rupees for a child per month. So it is attracting also the parent, because the cost of living will be more, the money will be more for the child if the child will be continuing life in the community. So we are encouraging the parent also.
Okay, thank you. That's a very interesting range of measures that you've introduced in India. And I think it's very much about trying to maximize opportunities for prevention, keeping the child in the family, but also permanency planning, which is the term that we often use. If the institution is a last resort and it's the shortest time possible, and then if there is an option either for kinship care or foster care, or you mentioned adoption too, then if that's in the long-term interest of the child, domestic adoption is a form of permanency planning, which is very much interesting to be considered, and needs to be considered early, obviously, so that the child doesn't stay too long without a decision on their care. So it's really interesting to see how you've built that, and you've structured it through laws, through finances, and different forms of support. So I think we just have time for one more question. I don't know if panelists, you can all answer a question in the Q&A. If you just go to the Q&A, and if you click on type answer, then any one of you could answer any one of those questions that currently remains open. But I just wanted to go to the question from Chipo, which was about, for Miriam, about the mapping in Jordan. Keen to hear about your experience of mapping the learning needs of social service workforce. Do you know anything about, could you say something about what worked and what was a challenge and what helped, and any key advice when, and this relates to some of the other comments we've had about studying social work. So, and the way to motivate people into going into social work. Was there anything in the mapping that looked at the training assessment, training gaps, learning needs of people, and that you could then use to strengthen and advocate for more appropriate training and education?
Yes, so the mapping basically looked at all the different phases of the planning, development, and supportive social work. And as in all countries, I assume, with the planning and the ratio of social workers versus children or versus service end users, there was an issue there. There were issues around the geographical distribution of social workers, also around the training, the background. Many of them, because of also the refugee reflux that we had to be quickly hired to provide services. So we have a big number of workers not from a social work background who have been working now for over 10 years with children and families. And the fact that we have a lot of also NGOs providing training. So you had, different modalities of trainings and all sorts. And then, of course, the average caseload for social workers and the supervision. So some of the recommendations that came around several notes, actually, we had the buy-in of the government and their very big interest in developing an in-service training program for social workers who are currently working amongst the workforce, but not necessarily from the social work background, to kind of regulate also the status of all the workers within this task force. So this is something that we're currently working with the government on, and hopefully it will be done in the coming year or so.
Thank you so much. Thank you so much, Mariam. And I tried to squeeze that question in under the line, but Florence, I can see your comment that there might not be time for closing remarks. Florence, if you want to open your camera and just wave, then we're just very grateful to the Better Care Network and to Florence Martin. Go over to you a sentence, Florence, and then I'll close.
Happy to wave. This has been an absolutely thrilling panel discussion. It just shows how critical the strengthening the social workforce is to care reform. It also underlined that it cannot be done without the training, without the resource, without the involvement of care experienced individuals, and it needs to happen at all levels. It's multi-sectoral. We're not going to be redirecting systems to support families, to support children in families, to support young people to transition from care and get better alternative care in families without a qualified, smart, supported workforce. So we're delighted to be here, and you have been very inspirational today. Thank you so much.
Thank you, Florence. Thanks to
remember
all
that this is being recorded. Just to add, it's being recorded,
yes.
So you will be receiving the recording in the languages. The thematic brief you've received is already launched, and you will be receiving the State of the Social Workforce reports by the end of the week as well. So thank you.
Yeah. So watch this space for those recordings, for those reports. It's Social Service Workforce Week, so every day you'll be getting updates from us and different things to read. And do check out the resources on our website. Some people have been requesting various resources. We'll make sure they're all available through the website, including other mapping reports and other country reports that are available. So stay in touch and stay tuned as we go through this week. And thanks to all the panelists and to Florence and to Jamie and for everybody opening and closing. It's been a wonderful event. Thank you so much. All the best.
Bye.
Thank you.
Thank you.
Thanks. And thanks, Beth, for a wonderful report and for introducing it as well. Thanks, everybody. All the best.
Bye.
Thank you.
Thank you.